When faced with a relative who is succumbing to the symptoms of Alzheimer's disease, the effects can be overwhelming. September is World Alzheimer's Month, and the Alzheimer's Association of Trinidad is working to raise awareness about the disease. Time to act on dementia. Time to act on Alzheimer's, the theme for the 2024 observance of World Alzheimer's Month. More in tonight's Health Check.
According to the Pan-American Health Organization, Alzheimer's affects over 50 million people worldwide, and this number increases every 3 seconds. Alzheimer's disease may contribute to 60 to 70% of cases of dementia. Other forms include vascular dementia, Lewy bodies dementia, and a group of diseases that contribute to frontotemporal dementia. The key to diagnosing Alzheimer's is a professional evaluation.
Must state that not all forgetfulness is Alzheimer's disease. That is a very important point, and that is why it's so important that an evaluation is done, which, as I said, may include blood tests, scans, etc., in order to arrive at an appropriate diagnosis. And that evaluation may require the patient or individual to be referred to a psychiatrist or a gerontologist to determine the type of dementia.
Alzheimer's is a progressive disease with many stages.
So it starts off with just a normal kind of forgetfulness. And as you go down the list, there are noticeable difficulties with the memory. And then you get more than memory loss. Inability to do normal daily tasks, and the person becomes increasingly more dependent, and symptoms get severe, and near the end there may be a lack of physical control, incontinence, they may be bedridden.
Dr. Williams says the benefit of diagnosis is that it allows the patient and family time for acceptance and time to develop coping strategies and plan for the future while the patient is still competent. She says the emotional impact on the disease can range from denial to disbelief.
A little anger, start to get vexed. Why me? Why me? And then the fear and the anxiety and the despair and the depression, and then the embarrassment and the shame. And sometimes that embarrassment and shame resides in the family members.
And while there are medications that can help delay the onset of Alzheimer's or help patients cope with emotional changes, Dr. Williams advises that non-drug interventions are also important, such as social interaction.
Make sure they call up their friends, let them come over, go for a little lime, live. Social interaction. Let the grandchildren do video calls and Skype. Make sure that some socializing takes place. All of that is important to draw the person out of their isolation, feelings of loneliness, etc.
And exercises that strengthen muscles, such as yoga, tai chi, and aqua aerobics.
If the patient can't move about much, you could sit down in a chair and exercise, Mind-stimulating activities, such as crossword puzzles, etc. The benefits of music therapy. This would be so soothing, really soothing.
In this month dedicated to increasing care for Alzheimer's patients, the Alzheimer's Association says it hopes to enhance knowledge on the disease for better care to be given. The Alzheimer's Association of Trinidad and Tobago can be contacted at 345-6549. I'm Karen Kozier-Phillip with your TTT News Health Check.